There we go. Recording in process. Okay. I'm also conscious that I often start by being incredibly rude and assuming that people know who I am. So I'm Allister, I'm Chief Executive of Coastline Housing, and I chair the Alliance. And Ben and Gemma, do you want to quickly introduce yourselves as well before we get stuck in?
I'm Ben Bolton. I have for the last 12 months been overseeing the Housing and Homelessness Alliance on behalf of the Voluntary Sector Forum. I've now moved into a different role, so I hope to be doing that moving forward. I said this last time we met, but this should be my last meeting.
You did, Ben.
I enjoyed the praise so much, I thought I'd come back again.
Yeah. And Gemma?
Hi everyone, I'm Gemma and I'm the engagement team assistant at Cornwall VSF, and I support the alliances.
Thank you, Gemma. Okay, so agenda today, we've got two things. We've got Catherine, who introduced herself a second ago, who's going to be talking to us about end-of-life care for people experiencing homelessness. We've got about 20 minutes for that. And then we've got about 30 minutes to have a look at the Alliance's terms of reference and objectives. I won't talk too much about that now, but the intention isn't that we're setting those today, it's that we're starting to get feedback to inform a session at the next in-person meeting of the Alliance. But we'll kick off with Catherine. I don't know, Catherine, how you want to handle it. If you've got stuff you want to talk through, if you want to take questions as we go through, if you want to go through something and then take questions afterwards, do you have a preference for how you do it?
I'm actually going to hand over to Sian because she's our engagement officer and she's got a presentation, so I will leave it to her.
Okay, so Sian, we've got 20 minutes, so it's up to you how you want us to engage with that. Do you want us to chip in as we go through, or do you want to go through stuff and then do questions afterwards?
No, definitely chip in as we go through. Whether you want to put your hand up or shout out or in the chat comments section, that sort of thing, all of it is very, very welcomed. My name's Sian. My role in Marie Curie is community engagement and development, and I cover the whole of the Southwest. And we're currently doing a piece of work at the moment to understand better the experiences of end-of-life care, life-limiting conditions, terminal illness, and death and dying within the community who are experiencing homelessness. And it's come from lots of different reasons in regards to kind of our 10-year strategy and other pockets of work we've done across the Southwest of recognising that it's a community that's often really left behind. There can be lots of gaps within systems, even within the way our services are set up. They're not designed to be flexible enough and aware enough of this community and how they utilize systems differently and how they have different priorities and how their kind of lives look differently from what our kind of usual cohorts that we're currently seeing is and are. So we're doing a piece of work at the moment kind of across the Southwest of lots of kind of data research, but a lot more of talking to organizations like yourselves who have experience on the front line in different areas, whether it's kind of voluntary-led, statutory, whether it's through the council, whatever it might be, but really trying to get under the surface of what the reality is. And I think in the different counties I'm speaking to, it's set up really quite differently. So there's some pockets of amazing work, great alliances like this, and other areas where they don't have the same level of resources and funded services and all of those different aspects. So at the moment, we don't know if and what we're going to do within this space, but kind of part one of learning about it all is understanding more. So I was hoping to kind of just ask some open questions and hear your experiences around kind of health and the gaps within it, as particularly around kind of end-of-life health, end-of-life care, palliative care, that sort of thing for this community. So I had one little question to start just for my brain. With the different services and people that you support, and it's people experiencing homelessness, does that encapsulate everyone of people with no fixed abode, sofa surfing, temporary accommodation, as well as rough sleepers? And is it kind of a bit of everyone that you would, between you all, be seeing and speaking to and supporting?
I think it probably would be, Sian. I'm seeing nods around the room, and probably not all of us all cohorts, but between everyone in the call. Yeah, Nikki's nodding. Yeah, so I think it would have a pretty broad coverage of everything.
Fab. And can I ask, within Cornwall, does the traveller community is that under your kind of cohort and community? Because in some areas it is, in some areas it isn't, and I just wondered what it was like in Cornwall.
That's an interesting question. We'll put that out to the room. My instinctive reaction is it's not something we've ever consciously talked about in the Alliance, I would say. Whether that means it's unconsciously in or unconsciously out, I'm not completely sure. Anyone got a view on that? Nikki, what from your perspective?
Well, I'm kind of looking at John as well. So the council has a gypsy and traveller strategy, and we do have responsibility for gypsy and traveller sites, and Cornwall Housing manage a couple of those. But John will probably pick up a bit better than me. If you wanted to come in, John.
Morning. Sorry I was late, so I didn't get to introduce myself. I'm John Warner. I'm Head of Service for Housing Options for Cornwall Council, so we cover the sort of main frontline services for homelessness. And I would say probably not, but obviously there's a Venn diagram of homelessness of where we do have gypsy and traveller families and households approach us as homeless for various reasons. But generally not, I would say. That will come under another part of the council, and probably Cornwall Housing as well in terms of gypsy and traveller liaison as a specialism, but not in the homelessness context. But it's a big Venn diagram.
No, perfect. Thank you.
And Kate, did you have something to chip in there?
Hi there, Kate Moss, Harbour Housing. So we, through our domestic abuse project, we will, I wouldn't say occasionally and I wouldn't say all the time, but there's a fairly steady stream of people being referred from the community, from the Gypsy Roma. I'm really sorry about getting this wrong. Gypsy Roma travelling community, and I would imagine that some of the other domestic abuse services and the drug and alcohol outreach services will probably pick that up. Some of them are kind of based within those sites or around those sites, or we'll have them on the radar because of something that's come up at one of the high risk things. But where that comes into the health thing, I know for some of the women we've supported, it's usually around really poor liver health due to alcoholism and domestic abuse, hospitalisation, that sort of thing. So we've got a few cases there, but I'd say it's still fairly separate to this alliance, I think.
No, perfect. Really, really helpful to know. Ben, did you want to add something?
Yeah, it was just to say that on our membership of the Alliance, we do have an organisation called Traveller Space. They do a lot of work with that community, and they haven't been a regular attendee at the Alliance, certainly during my time, but they are doing a huge amount of work with those communities and are always very, very happy to engage. And I can certainly make a link to them if that helps.
No, perfect. No, that's really, really helpful. The reason I asked is because I never considered it to be potentially part of the Alliance and the community and things like that. But when I was in Somerset, a lot of the work they were doing kind of crossed over a lot. So I thought I'd clear that up from my brain at the beginning. So I suppose my first kind of open question, and this is all very new to me. So my question is, when someone's health starts to really deteriorate within Cornwall, what kind of tends to happen? What services are available and how do people tend to engage with them?
Hi, we have health for homeless at our drop-in centres, which our clients link in with. So that's a regular GP service that they can access when they're rough sleeping or vulnerably housed.
And is that... Oh, sorry, go on.
Just going to say, we have similar, our homeless service. We have a GP practice based in the building as part of that programme.
And so would that be a few kind of named GP surgeries from around Cornwall, and they have nominated people that then come out and provide support kind of within the community and within those locations? Is that how the setup is?
We have regular drop-ins with the Health for Homeless team. So they have an office at our drop-in centres, which our clients can access.
I think it's a specific group of medical professionals. Yeah, Henry's nodding. So it's not, yeah.
There are sort of a separately commissioned set of GPs, as well as psychologists and some nurses and that, and they work with or alongside some of the GP services, so they can have access, example, to some of the healthcare. I think it's St Austell and Newquay. I'm not sure elsewhere. So they can sort of see the prescribing, see the journey, see the notes, see the hospital admissions and things, and then they'll come place-based, like Angie said, into their drop-in centres. And then for us, like yesterday, for example, they were at our HMO in St Austell at one of those, and then they'll do also appointments to other our other places within that community, and then in a couple of weeks' time they'll be at our place in Newquay. So they'll see a lot of people there. And can link in, and it's very open access. So even if you deregister from Health for Homeless because you've got a surgery, they're not like you can never come back or you can't see us. Yesterday we were talking about someone who's kind of on the cusp, but actually engages better because they're likely to be quite transitional and maybe homeless and here, there, everywhere. So that's a really good way. They know a lot of people. They've known a lot of people for like 10, 20 years. So they kind of understand the journey and the trauma potentially better than, seeing a different GP every time. But yeah, they're really fantastic. And also we've got the homeless patient discharge advisor team within Trellisk Hospital. They sit within their safeguarding team. So ourselves and maybe I think some other organisations have hostel discharge beds, so people who are going to be homeless can be discharged directly from either mental health or physical health needs wards. So they could have been in long term or they could have just been in short term, and then they're discharged to like a step down facility for up to 12 weeks. So that's commissioned through adult social care and has partly been through housing as well. So there's a few around the county, but there's specialist things, and we've got a dignity in death and dying suite as well. So we've got like palliative care suite, but we'll often have people who choose to stay within our larger HMOs because that's where they want to continue with their lifestyle, and that's, we'll have in reach from district nurses and stuff. So there's a few bits and bobs. It might be worth coming out to see us and the other people that have got some of that going on. We've had some cases that, it's never nice when someone passes, but you can try and do it in the best way possible. But that link in with the hospitals is really key, especially the mental health.
No, definitely. It sounds really interesting. It sounds like you have a really good flow in the sense of in other areas. Some of the organisations that I've spoken to, that's a really big issue of people going into hospital, their needs becoming much higher, not being able to be discharged into the places they were before, and then becoming homeless or street homeless again in the time that they most need that level of support. So it sounds like there's kind of some good commission teams in place.
Practice, but that's only a small part. There's loads of other stuff. That's a very specific cohort with quite specific needs. So I'm not sure of other things, but there is some really good. That team's been at the hospital for well over a decade, I think. Amazing. So they've got some established links.
No, definitely. And in regards to kind of serious and life-limiting illnesses, what's your experience of so the feedback that I've had in other conversations is one of people potentially not being registered at the local GP or not feeling able to access them if they are registered. Obviously, you've got some clinical services within the community that sound really great, but they also have the personal challenges of not being a priority to maybe go and get tested for something or follow up with a scan that they might need or follow a health plan afterwards. What's your kind of experiences and feelings around the community of anyone that who've had kind of serious health issues but may have not wished to address them in the way that you would maybe ordinarily think someone would or could?
And I think the Health for Homeless might help with that a bit because they're not expected necessarily to go and see a normal GP practice. It's more based where the individuals are. But as I often say, I am not the expert on this stuff, so please someone chip in.
No, definitely. It would just be helpful to understand like the barriers that people personally face, because I think sometimes there's assumptions from our organisation, for example, of like our door is open, anyone can come in, and it's access for all sort of things like that. But in the conversations that I've had, there's lots and lots of reasons why that's not the way that life actually works, whether it's complexities, whether it's addictions, whether it's anxieties, whether it's other health kind of mental health and things like that. What do you feel kind of the barriers are of people's thought processes, maybe more around it? John?
It's probably wrong to sort of rely wholly on a couple of anecdotal sort of cases, but we deal with some of the most complex people with the most complex trauma that are there in Cornwall at the moment through the homelessness systems. I think across all of our organisations here, we do get people that don't want to engage for a variety of reasons. It could be to do with that trauma, but it can often be masked by drug and alcohol problems as well, which make it really difficult, even if those drug and alcohol problems are actually causing them some really, really serious health implications as well. So in the cases anecdotally that sort of escalate to my sort of level and where we need to get involved, we're talking at trying to get MDTs and safeguarding meetings in place for people, because they're just making unwise decisions. But I think we'll all be familiar with trying to navigate the route of whether someone's got capacity to navigate the decisions that they're making, or should be making the decisions they're making. That's a very complex route still, and I still don't think we've mastered it. And it can be very long and complicated and confusing. And we speak to one social worker, you might get, and I'm not blaming. This isn't a blame thing. This is the how complicated human beings and systems can be thing. But one social worker might have one opinion, another social worker might have another opinion. We've got eyes on them all the time. We're trying to escalate the information that we're seeing. It can be long and very protracted, and all the time we're holding the risk of this person potentially doing harm to themselves, or actually doing harm to themselves all the time.
Yeah.
So we haven't cracked how that. I think there's work underway. I think there's a recognition of this in the services and across the services, but we still haven't found, and we see it coming out in safeguarding adult reviews and other sort of serious case reviews and stuff like that around capacity, and it's probably a national problem. I think there's a general lack of understanding and consistency across all services about what that process is, and that's where it ultimately gets to. Is that you're looking at like a deprivation of liberty type sort of situation where you can stop them from making these decisions and try and force them, which is a horrible way of putting it, but into accepting the help that you think they need. Sorry, that's my higher level perspective.
No, I really appreciate that. I think, that's a real complexity for us to be aware of and consider, and that is the reality of lots of the situations.
And there's loads of different factors. Yes, it's relationships that they're having with people, other people, street homeless people as well. There's DASV in there as well. In some of the cases, they're really, really complicated to try and unpick, and trying to get that person to sit still for 5 minutes so you can try and unpick it with them is an added factor as well. So,
no, definitely. And Kate, you wanted to add something?
Yeah, just following on from what John was saying, I was going to say around the capacity side of things, particularly for people with, co-occurring mental health and substance use, it's very difficult. But like he said, like John said, if you can come together and you can share the risk, you don't just see that person as a risk, you see it as, somebody that you can support. And I think that it is, sometimes it can be very frustrating, but you've just got to keep getting that picture of safeguardings, even if 5 or 6 get thrown out and someone's hospitalized 6 times, this, that, and the other. It's the barriers, but the biggest barriers is that person can't advocate that for themselves, because they cannot stop either going towards the risk, or they're just kind of engulfed by it. So that's kind of the only thing sometimes we can do, is just come together to share the risk and not kind of expect that person to fully get a change or leave the environment. I was speaking to Health for Homeless yesterday, where it was suggested that there was a dolls put in place, but of course when you're in a an HMO and you've got your own front door and there's absolutely no need to do that, it's impossible. You can't sort of lock someone in. But finding a care home for somebody who wants to continue with the lifestyle he's continuing with is going to be really challenging for the other patients there. So it's about how do we come together to kind of manage that risk? How do we work with the community? So it takes, I would say, I think yesterday I took 4 times as long just figuring out that plan with the staff and with the housing and everything like that, just to look at that, because it's, you know, it's just a potential homeless person. It's like, what can we do to look at that? There may be something at the end of the day that we haven't thought of, or that could be that we can't do much. But actually the way it's working is that having that inreach from Health for Homeless support us to understand and everything, it just really helps that confidence. And you know, I think that it's so important to have that inreach. You wouldn't have a hospital without nurses, doctors, receptionists. So why would you have somewhere where there's lots of really unwell people without a little bit of medical intervention, inreach? It doesn't have to be a care home or a medical facility. So I think, like, we're quite lucky in Cornwall, we've got these places where they sort of blend. But the health inequalities, you know, you've got people who are really young with things like COPD and emphysema. So they go to your GP up the road, oh, you're 30 years old, stop smoking. Great, they might do that. But actually, you know, how has that person got to that stage? You know, there's potentials of other things. You know, people will suddenly have a blood panel done, you realise they've been in, you know, horrendously anemic. But a GP down the road is not going to think of that, because they'll just say, well, look, your lifestyle's horrendous, unless you get your diet sorted, that's not going to work. But it's like, actually, those little things could be really helpful. You know, things like nutrition and bits and bobs. We wouldn't begrudge somebody at end of life from having that. Whether they carried on smoking or not with lung cancer or that. So it's it's an attitudinal thing. And I think you can't expect your general GP to have all of the time and all of the clarity of around somebody's trauma when they're dealing with, you know, families all day and you know, all sorts of things. I think you need that specialism. And it's like relationship based, you know, John. Somehow some of us have carried on doing this. I think it's because we enjoy the fact that, you know, we know a lot of it's relationship based. It's therapeutic to have an understanding, and even if someone has a bad memory of coming to one of your services, they'll remember it because you tried to help them in some way. You know, and you cannot do it as one agency. You have to do it together, and the barriers are so they're so obvious sometimes. We'll just walk up the road, but that expectation is not one that's mirrored by, you know, within somebody's daily life. So we shouldn't be making it up for them. So it's quite complex. But I think that capacity thing, you know, the hospital deemed this guy not to have capacity, so they sedated him for a procedure, but then he was fine when they discharged him. So we're building this case. We've got MDT every Thursday for an hour for him, and it's like, you know, it's that style of work, but you can't do it for everybody, because you'd have to well, it'd be very difficult. But if we can get like I think the system is working better. There'll only be a few people in that kind of situation, hopefully. But yeah, it's very, very, very challenging.
Now, Shan, I'm not sure how well we're doing working through the list of stuff you wanted to explore.
No, I'm not going to.
Absolutely fine. So it's absolutely fine. I will wrap up there because I'm conscious of your agenda and it's really busy. I will possibly reach out to Ben and just see if I can get some contacts for the health homeless movement come out with, I think the invite was from Kate, about coming out to see some of the things that would be really, really helpful to put more colour and more imagery on it. But thank you so much for allowing us to come and pick your brains and ask questions. I think Catherine's going to drop off now because she's got somewhere else to be, and then I was going to hang around in the background if that's okay.
That's fine, Shan. And Shan, just when Ben and I were planning for the meeting, one thing that we were reflecting back on was, I think last year we had a presentation and I think some follow-on work with various organisations from Natalie Swan, doing end-of-life stuff funded by Macmillan through the ICB. Is that something you're aware of, Shan?
No, it wasn't. I can do some research, but if you have any information, that would be really helpful.
Natalie's not in that position anymore, Shan. I can fill you in.
Okay, perfect. Catherine knows.
That's fine. Thank you for having me. I'm going to drop off, but thank you, everybody. Take care.
Cool. Thank you, Catherine. Okay. Thank you for that. Right. Some really useful sharing of stuff there. Hopefully that was useful for you, Shan, and can follow up with more things as well. So next bit on the agenda then is looking at the Alliance terms of reference and objectives. As I said up front, what we're not looking to do today is actually set objectives or anything like that. We're just starting to gather feedback from people. We've talked a few times at recent meetings over or about the fact that the creation of the partnership board through the new strategy, which is something that we were really delighted to see and something we championed as an alliance, but that changes the kind of dynamics of the system that we work within in a positive way, but also means that as an alliance we then need to think about exactly what our role is and how we take things forward. We've done some things around that already with input from you and a lot of really good work from Ben as well. And we've produced a couple of papers for the partnership board to help explore how we think we can work most effectively together. And I think it's a continuation of that journey today, probably, Ben, what we're trying to achieve. We've put together 5 questions. We have got, I guess, slightly less than 5 minutes for each question now. We've also shared them via email in advance. Which the idea of that was to give you some time to think about them, potentially. Also for people that aren't able to come to the meeting, and we will share them after the meeting again as well, so that other people can feed into them as well. And then that will help us get a good starting point for the in-person meeting, which I can't remember when it is. It's probably in August, I'm guessing, but I can't remember off the top of my head. But the what of July, sorry?
23rd of July.
23rd of July. Thank you, Ben. Help us prepare for that. So, before we kick off, anyone got any questions about that, what we're trying to achieve? I'm hoping everyone's just cut almost fingers in the butters with amazing input for us. So, Henry, I can see, is bursting now. Let's start with number 1. So, the positioning paper. So that was the paper that we took to the partnership board back in March, following conversations here. So we've shared that in advance. Hopefully a lot of you will be familiar with a lot of what was in there anyway. So considering that and considering our terms of reference as a group, has anyone got any thoughts about the Alliance's terms of reference and how we work and what we're focusing on that we might need to think about? But I dread. Everyone just stares at me.
I'm happy to come in if nobody else.
Thank you, Ben.
Yeah, I think the terms of reference have evolved over time, but I don't think we've gone back and really revisited them since the establishment of the Homelessness Partnership Board. As Allister's just said, I think the creation of that group does change things significantly for the Alliance. I think it gives the Alliance some massive weight now. It gives the Alliance a real focus around delivering that strategy. So I think it has changed the landscape for the Alliance quite considerably. I don't personally think the terms of reference reflect that. And I think when I think about all of the alliances, the drive is very much to have that strategic level input and work on systems change. And I think maybe that's something where the terms of reference could be strengthened a little bit, recognising that changing landscape.
Thank you, Ben. Pausing to see if anyone's got any other reflections on that. Okay. And before we move on, I'll maybe just quickly share what we said was the overall vision of working to prevent and end homelessness in Cornwall, and then the things that we said we would work together on, just to see if this prompts any thoughts from anyone, to be the voice of the voluntary sector in homelessness, to ensure the voice of lived experience and lived expertise is heard, provide peer support encourage compassion and trauma-informed practice, learn from each other and other places, campaign and support campaigning for long-term joined-up solutions, prevent duplication and ensure sound communication between the other voluntary sector alliances and other groups that consider homelessness in Cornwall. That's still landing with people broadly. Seems to be. Okay. All right. Thank you, Ben. So I think that would suggest that the initial feedback is evolution rather than revolution on the terms of reference. Okay, so the second question is more about how we work. So what we've evolved to over time is, I think, a recognition that where we want to take forward projects as an alliance, that we're best placed to do that in meetings, either these virtual ones or the in-person ones that we have 4 times a year, recognizing that it's often difficult for people once they leave these meetings with enthusiasm and good intent to then have the time and the bandwidth to take things forward outside of the meetings. So we've adopted an approach where we try and do the work when we're together rather than when we're apart. So the question we wanted to pose is, what is good about that approach and what do you think could be improved?
I'll just say, I think it works well, because I think you rightly say that it's very difficult for people to work outside of the meetings because everyone's got different agendas and day jobs. And so working in the meetings is fine because I think we've got a good structure of agendas and topics. So as long as that's focused, that's okay. I think the big challenge, and we've said it before, is participation in terms of number of different organisations that could make us more effective as a group who don't attend. So, but I don't have a solution for that, and I'm not sure that we've come up with a solution for broadening participation.
And Henry, can I just check then, in attendance, you're not just talking, or maybe not even talking about consistency from one meeting to the next, actually some organisations that we don't get at all,
correct.
who we'd like to get. I won't put you in the position, Henry, of saying who you think those are now, but maybe if you could share those with us afterwards, unless you want to tell us now who you think it is.
No, that's fine. We can have a thought, but it's I think it's a combination of both. There isn't regular attendance from everybody. It's been great to see the attendance kind of change, but there are noticeable gaps.
Okay. Thank you, Henry. So generally a good approach, but relies on having focused agenda setting and planning, and could be improved if we could have more of the right organisations and more consistency. Okay. Amanda?
Hi. And whilst we talk about people with lived experience, do we invite anybody along when we're kind of making any of those decisions? Or do we have the discussions and then take it back to them to feed back on? Would it be good to actually invite them along sometimes?
Just making a note. I believe the position the Alliance has come to on that before is that the different organisations do quite a lot of it. So rather than duplicating it, we can bring in what those organisations do, but interested in views on that. That's an approach we have tended to adopt. Do people think that is effective, or should we think about doing it differently? Luke?
I remember we had a really big conversation, didn't we, about being wary around.
Yeah, I probably missed that one, sorry.
So about re-traumatizing people, so doing it away from this in a compassionate way, bringing voices in. I was in Truro a long time ago now.
Yeah. Albeit that there might be ways that we could even if we're not bringing the individuals into the group, there might be ways that we can think about how we more actively bring the voice into what we do. Nikki?
Yeah, just thinking about, there's quite a lot of activity in terms of engaging people with lived experience. There's there's lots of initiatives when the council are doing and kind of bringing people in. It might be quite good to think about how we utilise information from groups that are established. as well, so that there's something for me about having a group that doesn't necessarily just report for one particular activity, but how we might be able to support something that develops a group of people with lived experience that are then able to comment on multiple things that are happening around the system that we could perhaps support collectively.
Yeah, and that's something we talked about at a recent meeting, I think, about how we as an alliance can do that sort of thing in some way, Nikki, of trying to capture and amplify that voice through the system.
Yeah, because the partnership board want to do that, but I know Martha's been doing loads of stuff with the RISE contract, and so there's quite a lot of activity, and then people
there have been emails shared to forward out for surveys and things.
But often what I'm hearing is some of that information actually is really valuable for other activities that are taking place. It's kind of how we utilise that information when people have given up their time to participate, I guess.
Sure.
But a wider system issue than not just this, I think, but might help.
Thank you, Nikki. Just pause to see if anyone else wants to come in on that question. Okay. Right, so question 3 that we had proposed, these, I think, this is always a trickier sort of question. It's much easier to answer a question about, is there anything there that maybe could be taken away? It's much harder to think about what's missing and what's not there. But regardless, we're going to ask. So question 3 is, what are the thematic gaps that we should be filling? Where do you see gaps in work around homelessness in Cornwall that you think the Alliance could be potentially playing a role? Is that an old hand, Nikki? It is, isn't it?
Well, yeah, it was, but I wonder whether there's something around as a group of people working on the voluntary sector on the ground floor around how you get effectively feed up what you think the gaps are into some of the systems. So like us being able to hear what those gaps are and what challenges you face when you're working with people, particularly around kind of the prevention work and statutory work. So I think there's something, I don't know how, whether I'm just talking out my bum, but it just, that kind of getting your views, you guys on the ground floor in terms of stuff that we might not be seeing or hearing because you're working with people experiencing homelessness day to day.
Recognition, I guess, in a way that one of the potential gaps, if this isn't getting a bit circular, one of the potential gaps is that the partnership board might not be cited on where the gaps are, whereas the people that come to the Alliance being a bit closer to practice might be better equipped to say, and there might be areas where the partnership board doesn't think there's a gap because they think there's something in place, but people are able to say, you think there's something in place, but actually there is a gap. Okay. Yeah, that makes sense.
And that might develop themes of gaps.
Yeah.
I think if that helps us look at some of the pathways for support and housing for people alongside some of the statutory stuff and some of those little glitches that continually sort of might help or hinder those barriers that we've talked about, that means you can see the system from all of it. And some of the stuff that John was talking about, our experiences, it's kind of it doesn't always fit with that trauma reform journey, but if we know about it and you know about it, you've got the gates and you know where they are, kind of thing, or what they're coming up at. Some of them might be insurmountable, but I think sometimes it seems really simple, stupid things, and it's usually outreach workers or support workers that are saying this sort of stuff, and he kind of just turns into this rhetoric. Oh, it's always been like that. So I think
potentially something around a more detailed exploration of pathways and how the process works. Okay, Luke.
I think this all into kind of links with what Henry was saying earlier about having more representation then from a wider community of people that are in support of this. One, for bringing back the voice, and also, I think, Nikki, there has been that happening. So there are some positive experiences coming out of this alliance in terms of gaps. Me and Nikki had a conversation quite a long time ago now, maybe a year and a half ago or so. And out of that has come a pathway for young parents and their children. So, so really good stuff is coming out of this where those gaps are being spotted. And Henry's right, the more people that we've got here from all over the place will highlight that more.
Yeah. Okay. Thank you. All right. Good job on a difficult question. I feel like a primary school teacher now. That's really bad, isn't it? Henry?
I think it's maybe just picking up on something Kate raised there, and maybe there's an opportunity to use this meeting to go into, without breaching any confidentiality, some case studies or examples that highlight some of the barriers, because I think very often the pathways or the services are present, but I think the effectiveness is sometimes the question or the piece. So I think in a non-confrontational and non-defensive way, if we can address some of those barriers, that will lead to really great, deeper understanding.
Okay. Yeah, thank you, Henry. Okay. So we're going to the fourth question there, which is starting to look a little bit more at, if you see me looking around my desk, it's because I'm looking for, I know I printed it out earlier, can't find it now. There we go. Thinking about our objectives, which were on the email. Oh, thank you, Ben. That's much more effective than me just waving a piece of paper at the camera, isn't it? Very professional. Is there anything that we've had as our objectives that you think is really no longer relevant, that could potentially be because we've completed it, or completed it effectively as you think we can, or potentially because it's maybe something that's now being led more effectively by the partnership board for whatever reason? Are there any of those objectives that we have been looking at that you think are perhaps no longer relevant? So very high level canter through. The objectives at the minute are supporting Cornwall Council and partners in delivering the new Cornwall homelessness strategy. Second one, ensuring the review of the local plan fully addresses homelessness prevention. 3 is mapping the groups that currently meet to discuss homelessness and broader issues. 4 was ensuring the voice of lived experience and frontline insight informed service design and commissioning. And linked into that is stuff around psychologically informed and trauma-informed approaches. And then 5, there's the 6th as well. 5 is trying to work with elected members to ensure they're informed about issues around homelessness, so that can inform policy decisions. And 6 is around statistics and data, and what the Alliance may or might need to inform the work that it does. So are there any of those that, well, I guess we could potentially cover both questions in once here, because the questions we were asking were, are there any of those that stand out to you as really you don't think they're relevant to the group anymore, or they're complete? Or are there any that you feel are essential that you would want the Alliance to make sure always maintained? Kate?
Just maybe number 6 with what we've been saying around the lived experience and the voice, maybe 6, I'm not sure what other number it is. Perhaps are we saying actually we can't do everything, but to prioritise the lived experience voice through case study, through like actual evidence? Do we, I don't mean we particularly stop one and start another, but can we kind of combine that in there and say if the data we want to look at is lived experience data, evidence-based, data that is actually also anecdotal, maybe we do that, because that can be quite time consuming to go through case studies and things like that, and then you end up with subgroups, this, that and the other. But if we want to focus on it, we don't want to go down too much of a rabbit hole with it, do we? Okay,
so let me try, because I'm not sure I've completely got you, Kate. I'll try and. Are you saying that looking at trying to do case studies and kind of data both would be too much? Is that what you're?
Not necessarily. I was just saying, if number 6 says to consider what statistics and information are most important to review at each meeting.
Yeah.
So some of the statistics and information, it's vital now, isn't it, that we get it right for the people who are dying or, really need support, and that it's vital that we get that right. We've got all collect data and numbers and this, that, and the other, but some of that, some of the lived experience voices, and which we will present through the form of case studies, will be the statistics and information that are the most important or very important to review.
Okay.
So we can update the partnership board with the actual happenings. I probably haven't explained that very well. Makes sense in my head, but it may be some, I don't know, or just not. Let's move on.
No, I think it's. I do want to explore that. So I think how I'm translating that to my brain is that the bit where we can maybe add value rather than going too deep into the statistics is making sure we're bringing the human story through the case studies. Not quite, Kate. Nikki's nodding. Kate's not convinced I've captured that. I just
thought that's an absolute maybe I've misunderstood what 6 means in its, like, as it is at the moment. I just thought it's the statistics and information. A lot of that is the case studies.
Okay. Nikki?
I guess I was just thinking there's something, isn't there, about hard statistics that we can provide and we can see, and then how, I think, touching on probably how I've seen that, is then what is that qualitative work that takes place in the sector that might not be picked up through some of that hard data that demonstrates where we're having an impact, and that might also then link to where we think there might be barriers or issues in the system because it's having an effect on people's ability to do some of that. So there's almost a bit for me around there's hard data, and probably that's more relatively easy to get in terms of the council churns out, and most organisations churn out a lot of data, but actually interpreting that data to what that means and how it is impacting services, and then how kind of sorry, don't know where that's.
And I'll bring John in a second. What I'm sort of thinking here is that the partnership board will have a set of data and statistics it's monitoring in its oversight role. So potentially what we don't want to do is duplicate that, but we could work productively with the partnership board to identify what some of the qualitative case study type information is that might help explore some of what the data is or isn't telling us. Is that looking at Kate as well to see if that's maybe coming close to where you were thinking? Well, okay.
Maybe let John let John come in.
Let John. Okay, John.
he might
don't rely on me to resolve this one for you, but I agree with Kate and Nikki. The data will get you so far, won't it? But some of the magic, or a lot of the magic, is in the qualitative stuff, and how people feel about stuff is never captured in data, or the missed opportunities, the number of different contacts they had isn't contained in any data, in my experience. But there's a nettle to grasp here about how we get that voice, and not just lived experience, but living experience as well. Because it's more up to date. Some of the lived experience could be historical, things could have changed, might not be as relevant their experience back then as it is now. Organisations change, people leave on a fairly constant basis all the time. So how do we get the voice and living experience in here as well, in a way that can lead to real change in services, and it's impactful as well. We need to hear it. Some of the most impactful encounters I have are with customers that are in my own systems or own systems now. And you think, well, I've got to do something about that. That's not right. So there is something about that, but then we run up against the quandary of re-traumatizing people. But some of those people will want to make a difference, because when I have engaged with people and I talk to them about, well, why didn't you get involved? Why didn't you change things yourself? This is bigger than, it's not just an us thing. Your voice is important. You can make a difference as well. and people need to hear what you've got to say, and you've got good ideas, you know. So some people might want to get involved, and I think we sort of hands off them because we're worried about re-traumatizing them, but actually their experience is valid and their input is really important.
Okay, thank you, John. That's useful. Any other thoughts on the objectives? Okay. That I think is helpful, Ben. Probably worthwhile.
The one that has been on there ever since I joined and we haven't touched.
Yeah.
Is number 3, the mapping.
Yes.
We keep circling around it, coming back to it, and we don't quite know what we mean by it, I think, is the truth, if we're all honest. So that's one that, unless we can really define that one much more clearly, it's one that we've not really touched in the last 12 months.
Yeah.
And it is talked about a lot at the partnership board.
Yeah. Jill?
Yeah, sorry, a bit late to this one, but I agree, Ben, but what we're going to have to do is to put some boundaries on how far out, because housing and homelessness, you could find a link to almost every organisation in the voluntary sector is impacted by housing and homelessness. So I think you're going to have to work out how far out to go, how great a touch there is.
I'm sort of wondering, and I know we're not trying to set the objectives today, so I don't want to go step too far forward, but linking it back to Henry's point earlier about trying to make sure that the reach of the Alliance and the number of organisations, we have the right organisations involved, that it might not be something as grandiose as trying to map everything, but it might be a conscious effort around thinking about where the gaps might be. So it's a slightly more focused piece of work. And not something that's trying to create a map that everyone can see and use that we keep up to date in some way. But it's perhaps a task and finish work at a meeting where we think about who's here and who's not here. Might be one way of doing it. Nikki, then Luke.
I'm wondering as well whether there's something about pathways, there's something about us communicating how people navigate some of our services and what's available that might actually help. So although that's the top bit of it, it feels like there's something, because we want to do a bit of work around how we do that in terms of communicating services and what's available and what pathways look like in a quite sort of pictorial way, is something like that starts that kind of, I think there's something missing for me around what does the system look like and how do people navigate that? Because and we recognise in the strategy that the information we have on the website is quite limited, just in terms of kind of what happens when you kind of come to our front door and what's available, but also what services sit behind some of that. So that I don't know whether that might be more useful as a kind of starting point.
Yeah, so I know we could use the pathways that someone might go through to think about what organisations are engaged and aren't engaged. Yeah. Okay.
It's got me thinking about the Lego exercise we did. Gosh, that was last year, wasn't it?
Yeah.
Which and people had these sort of models that was like hubs and spokes, and it was quite, everyone had a different thing. They described it, and it's like, that's really useful to have that visual almost of that. And I think everyone was trying to do it there. A lot of us were there anyway, and it just feels like that's sort of the mapping and everything. It centers on, you can't always document every single thing that goes on, but you can have a general picture, can't you? Just
Thank you, Kate. Okay, so that's really helpful. Like I said previously, we shared the questions before for people, and we'll push them out again after the meeting as well. So that means that people who aren't at the meeting, if they've got time, will have a chance to contribute. Anyone who's at the meeting, if either something occurs to you afterwards, I know some people like to reflect on things, please do share them back with us, or if it's something that you didn't quite want to bring up today for whatever reason, please share it with us and we'll gratefully accept all feedback, because the more we get, the better it will shape the discussion at the next Alliance meeting around what objectives we set ourselves going forward. Okay, right. I'm not going to allow us to do AOB. Oh, no, there is an AOB, Ben. I was going to say we can't have an AOB because it's 11, but there is one AOB, isn't there?
Yeah, very, very quickly. We have been approached by the local plan team to say that they are now heavily into the process of creating a new local plan for Cornwall. And there is a workshop that they would very much like a participant from the Alliance to attend. Neither Allister or myself can attend that one. It is on the 13th of July, 10 till 12:30 at Crowley. Looking for a volunteer to attend that and to report back to the group, really, if that would be okay. I can send it out wider by email after the meeting. If there's nobody at the meeting, we can do that. But we're looking for a volunteer for that one. It's a really important meeting that we want to be represented at. I'll send an email.
I'm happy to go unless anyone else wants to.
Thank you very much, Henry. I will send you the details, Henry.
Super. Thank you, Henry. Okay. In that case, thank you very much for your contributions today. Another huge thank you to Ben. If we say thank you to him enough, maybe he'll keep staying. For everything that he's done. We will reshare the questions after the meeting when we share the summary of the meeting as well. Please, if you've got any further thoughts, please share those back with us, particularly Henry, if you've got any thoughts about that, people that may not be here, although I think from what we've discussed, then maybe that's something we pick up at a meeting when we're together and actually think through it together as a team about pathways and things like that. But if you have anything to share in advance of that, please do. Other than that, I hope you all have a fabulous day, and I will see you all soon.
Thanks, Henry. Cheers, everyone.
Thank you.
Thanks everyone. Cheers.
Bye.
Thank you.